Okay, hello everyone. Welcome to this episode of Cooperatives in a Time of Crisis. My name is Stan Yu, and I am the Research and Communications Coordinator for the Canadian Centre for the Study of Cooperatives. With me today is Jen Budney. I will let her introduce you to her role as she wears many hats. But first and foremost, welcome, Jen.
Thanks, Stan. So this is funny because we are brand new colleagues. I am a professional research associate at the Canadian Centre for the Study of Cooperatives, and I've got a long experience with childcare policy issues in the province of Saskatchewan and on the board of Saskatoon's oldest licensed childcare centre that has 4 locations in the core neighbourhoods of Saskatoon. So we're here today to talk about childcare in a time of crisis.
Great, wonderful. So Jen, delving into this a bit more, can you tell us a bit more about both your academic and board experiences with childcare cooperatives in Saskatchewan, and kind of why there's such a need for childcare cooperatives in our province?
So I'll tell you a little bit about my board experience first. As a parent, I joined the board of Spadina Early Learning and Childcare Cooperative, which has 4 locations in Saskatoon, at St. Paul's Hospital, in Princess Alexandra School, at École Victoria, and at Lester B. Pearson School. And these are all schools that serve core neighborhood families. And the hospital, of course, is centrally located right in Pleasant Hill. So I got to know some of the issues facing the childcare sector through my work on the board, and I had a wonderful student in a course I taught with Brett Fairbairn on the social economy and public policy, Courtney Carlberg, who was completing her master's degree in sociology looking at childcare policy in Saskatchewan. And so in our conversations, we managed to do 2 things. One, I managed to rope Courtney onto the board of Spadina Early Learning and Childcare Cooperative. And then also Courtney and I began to write together about childcare policy in Saskatchewan. And we published a piece last year for the Canadian Centre for Policy Alternatives on Saskatchewan's failing report card on childcare. Saskatchewan ranks second lowest in Canada in terms of many quality indicators for childcare, right behind Alberta, actually, where they have almost no cooperatives. They're mostly for-profit enterprises in Alberta, and here we are not-for-profit cooperatives. This was something that was legislated in 1974 by the NDP government. And Canada itself ranks 24 out of 25 amongst OECD nations in terms of quality of childcare indicators. So we are doing very poorly in this province. And in fact, according to a different study by the Canadian Centre for Policy Alternatives, Saskatoon is the only city that is in every neighborhood classified as a childcare desert where there are not enough spaces for children in quality licensed childcare facilities.
Those are some staggering and disappointing numbers there, Jen.
Yes. Yeah.
Why is that the case?
Well, that's a really good question. And I think partly, I don't know why that is the case. But I have a few ideas, and one is that Saskatchewan has been, despite some progressive policies in terms of universal health care, North America's first arts board, things like that, we are a very conservative province with a lot of what you might call old-fashioned values historically. And we were also a have-not province. So housing was very cheap for a long time, and I don't actually have the stats on this, but it could be that either many women chose not to work, or the province was somewhat had blinders on in terms of how many women were working, and I suspect it's the latter.
Mm-hmm.
So the other thing that I think hampers hampers our discussions on childcare, perhaps, and this is kind of funny, but could be the cooperative model itself. So we are a very fragmented system. Every organization kind of has to put all of its energy into building and sustaining its own organization. It leaves very little energy and resources for networking, for mobilization, for advocacy. You know, anyone who's involved, almost anyone who's involved on a board of a childcare cooperative is a working parent. So people are already very, very busy.
Mm-hmm. No,
So it's
thank you
part
for
of it.
sharing.
Mm-hmm.
And with the cooperative model, as it relates to childcare cooperatives, can you shed some light on how it compares to private daycares?
Well, I think that there's a lot of, Saskatchewan has the second highest number of cooperative daycares in Canada out of all the provinces, behind Ontario, which of course is vastly more populated than Saskatchewan. But
Mm.
I think that daycare co-ops in Ontario tend to function more like perhaps how they originally conceived to be, which is parents who are kind of very actively involved in operations, where you might volunteer one day a month or one day every 2 weeks, but parents are more hand-on. And here they function much more like nonprofit organizations. So we have professional staff who are trained early childhood educators, and of course any of the funded daycares in Ontario would function like this as well. They would have to have trained educators in the staff. So anyway,
Mhm.
I don't know about Ontario as much, but here we function as nonprofits. So we have professional staff. I think the advantage, the one things, and there's a curriculum that's established by the Ministry of Education for early childhood education. And so there's not a whole lot of room for parents to make choices around programming or styles of education for their children in the licensed centers. But where we do have flexibility to make decisions as a board is relates to the fees that parents pay, because about 90% of the budgets for these centers come through parent fees,
Mm.
and salaries for the staff. So that's our flexibility as a cooperative board. That's where we can make key decisions. And of course, we have all the policy, governance oversight that any other board would have.
And would you say that the different cooperatives, childcare cooperatives, how would they differ between each other? Are there vastly different models that currently exist in Saskatchewan, or are they do they follow similar approaches? Can you shed a little bit of light on that?
Mm. So one thing I'll say is that the childcare sector is very understudied here in Saskatchewan. So there's a
Mm.
lot of data I would like to get on differences between childcare cooperatives in Saskatchewan that I don't have, and we can't find anywhere. I can tell you that within Saskatoon, the major differences you will find, depending on which neighborhoods the co-ops are located in, is in the established fees for children to attend. And that makes a difference in who is able to attend. So the other part of the childcare equation, there's a small amount of operational funding that comes from the Ministry of Education for all licensed childcare centers, including the licensed home daycares, which are different than the licensed centers like Spadina Early Learning, like the co-ops. But there's also some demand side subsidies that are issued by the Ministry of Social Services for low-income families.
I see.
And what's called a full subsidy, or your maximum subsidy, still leaves the poorest eligible families having to pay 10% of the remaining fees, or 10%
Mm.
of the fees. And because our organization, the one I'm involved in, is located in the core neighborhoods, we try to keep our fees as low as possible so that we can be as accessible as possible. in other parts of the city, there are many licensed childcare cooperatives where the fees are set so high that no low-income families, anyone who is eligible to receive subsidies, still can't afford that 10% that they have to pay. So those childcare centers have no families with subsidies. So that creates, there's kind of it's a kind of punishment for the co-ops that serve low-income communities, because we're dealing with two ministries, first of all, instead of just the one. And there's a whole lot of additional administration that goes along with the subsidies, which are paid out monthly. There is a delay in payments consistently. And if typically the Ministry of Social Services will be 1 to 3 months behind in sending us the fees that they owe for the families that they're subsidizing. And, the families who receive subsidies can have a lot going on in their lives, which makes bringing their children on a regular basis difficult at times. And if they don't show up for a certain number of hours every month, they're not allowed to continue coming according to the ministry's rules. Or they may not be able to pay their remaining 10% when they thought they could. And if they don't pay, the ministry doesn't pay. So we have a lot of bad debt as a result. So those childcare centers, the co-ops that are serving lower income communities, accrue bad debt that other childcare centers don't accrue as nearly as easily. So that's a problem. Another big problem is that the subsidies for low-wage families have not been adjusted in terms of what the maximum salary you can have to be eligible for subsidies, haven't been adjusted since the mid-1980s.
Oh, wow.
So they are painfully low. You need to be eligible with one child, to be eligible for a maximum subsidy, you can't really be earning more than, I think, about $19,000, $20,000 a year. So it's the average family, if you had two parents working minimum wage jobs, you wouldn't even be eligible for subsidy. So there's a whole range of low to middle income earners in Saskatchewan that can't afford childcare because they earn too much. They can't get the subsidies, but they also can't afford to pay for childcare in full. So many families are simply excluded, which means one parent's going to have to make the difficult choice not to work, or they have to find potentially substandard childcare in an unlicensed facility or a private home.
Which
so
makes
there's lots of issues here. There's lots of issues.
And which makes their own situation even more stressful.
Yeah, of course. Yeah. So one of the things that I'm interested, I think we need a lot more research on the cooperative model for childcare in Saskatchewan. I think that during this COVID pandemic, it became very clear that, although many of us knew it already, it became crystal clear that the current model doesn't work, the current system doesn't work. There was a lot of confusion around whether or not daycare centers were going to stay open. Some were closed down in schools and then given the option to reopen for the families of essential workers. And then suddenly all early childhood educators were deemed to be essential workers themselves. And, our board, for instance, had to make a lot of really tough decisions around whether we kept our 3 school locations open. We didn't have a lot of numbers in terms of how many children would be coming and what the rules were. There were going to be extended hours. They wanted us to keep extended hours for the families of essential workers. We weren't going to be receiving any more money, and we didn't know if we'd have enough children to pay our staff because we wouldn't be receiving fees from our regular families. So that was just our one childcare center. All around the province, there was so much time being spent by individual boards having to make these really difficult decisions in a period of uncertainty that when I think back to how many hours must have been spent collectively by how many people having to make these decisions, I think surely there's got to be a more efficient way to do this. And the other thing, of course, is that as essential workers, early childhood educators, like other essential workers out there, like cashiers at grocery stores, they make very low wages. And it did not, for us, seem to be right to ask our employees to put themselves at risk to go into these very uncertain conditions for such low wages. So we made the decision to close the school locations down immediately and to not reopen them for essential workers. As it turns out, I think although there was some demand for childcare services by essential workers, it wasn't enough to even warrant keeping most of the childcare centers that stayed open for them open, because there weren't enough children coming.
Okay, can we delve into that a bit further, Jen? So using Spadina Early Learning and Childcare Co-op as an example, what were the responses that you were receiving from members? What were the factors that the board took into consideration before making that decision?
Well, there's always an interesting tension in the childcare co-ops, because we rely so much on our educators to take care of our children, who are our most precious things to us. But we also want to keep our fees low. And because 90% of our budgets are spent on salaries, the only way to keep our fees low is by suppressing the wages of the workers. So it is a very difficult model, and for boards that are aware of the inequities involved in the staffing of childcare centers, we do our best at Spadina Early Learning to increase the wages, but we're not given very much to do that with. And there's only so much we can increase fees on an annual basis for our families. And that means that for the most part, we have very little means to increase the wages of our staff. Every once in a while, there's some kind of top up by the federal government, and it usually amounts to being able, like our last top up from the Liberals, our childcare center was awarded an amount of money that allowed us to raise our level 3 early childhood educators 0.5% wage increase. So it was almost meaningless.
Not a lot.
No. So I think that while I understand that in theory the cooperative model should give parents some security in being able to monitor the quality of their childcare services and to make decisions around what kinds of childcare they want their children to receive. In reality, because of the regulations around childcare, because we do receive very small amounts of operational funding, and we want that funding because otherwise childcare would be completely unaffordable. What it means is that there's a curriculum set by the government. So the kinds of more hands-on operational decisions that we might want to make around what sort of education we want our very young children to have, we don't get to make those decisions in the co-op. So we end up just having to juggle this fees versus salaries. And then if there's any additional fundraising outside of that, the burden is put on the boards to do that as well, primarily. And like any co-op, large co-op, our co-op has about 250 children in it, about around 60 staff. So it's a sizable co-op, and all of the families have their children in there because everybody's working really hard. So there's not a lot of free time that families have for doing the fundraising.
Mm-hmm.
So it's an interesting and strange model for childcare, and my feeling is that it actually may not be the best one. I think that having a public system, universal childcare program could be much better. And then I don't know what the governance of individual centers would look like. Could look very different.
I like to delve deeper into that question or into that point in a second, Jen. Just to backtrack and follow through with the your current co-op, looking at the most recent Saskatchewan's plan to reopen our province, there was direction in that plan that said something along the lines of daycare, childcare facilities can expand to a maximum of 15 children now once phase 3 of the plan is in place, of which a date has yet to be set. But knowing that that phase is forthcoming, are you hearing anything from either your board or other childcare cooperatives in terms of what are the considerations around planning for that phase 3?
Mm-hmm. Yeah, so what's funny is that not all childcare centers were closed during this pandemic. So we had the option of keeping our St. Paul's Hospital location open throughout the entire, the whole time. We did eventually shut it because we had only 3 to 5 children that were coming on a daily basis, and we actually couldn't afford to keep it open for them. We couldn't afford to pay our staff with only those very small number of fees.
Mm-hmm.
Having done a survey of parents recently, we think that we will have the ability to reopen in June our St. Paul's location, which is before the TBD that our other centers are waiting for. And we will have to open it at half capacity. So there's normally about 65 children in that space in many different rooms, and we would likely have to keep it at about 30 kids. There may not be the interest from 30 families at that point in June, but as we continue to reopen the economy, as they're calling it, we may see more demand, but it's really hard to say right now. So it's a lot of decision making. It's very hard for us to plan at this point because we don't know what demand for childcare will be. We don't know how comfortable people will be sending their children to childcare facilities. There was a very funny comment made at the beginning of the pandemic when the daycare centers were kept open and the schools were shut.
Right.
And it was said that it was okay for the daycare centers to stay open because there's such excellent hand washing protocols there. And it's true, our staff are very well trained in hand washing, but that goes nowhere in terms of preventing the spread of germs, really. Like the common cold, it's all you get in kids when you send them to daycare. So I think that some parents could be very nervous sending their kids to childcare before we know if there's going to be a second wave or what the health situation looks like when we reopen.
I can imagine for parents that can go back to work now, it would be that balance between safety versus the need to work, and subsequently what to do about childcare would again be one that's weighing on many families at this time.
Mm-hmm. So people who have, I know families that have been forced to, one of the big issues that we have right now is school-age children who are not eligible to go to the few childcare centers that are open right now, but they're quite young. I know of families who are essential workers and are having to go in the office, who are being forced to leave their children at home alone during the day right now. So there's some coordination between the schools and the childcare centers in this to prepare for this kind of scenario. I think would be a really good thing to do because we have these spaces. Some of them, like our St. Paul's location, is still allowed to be open. We've shut it because we can't afford to keep it open, but I think that creating one system where the early childhood education centers, the daycares, were in coordination with the schools could be very good for a situation like this. We could multi-purpose them in this sort of time. It's a lot of hard decisions for everybody right now. It's a lot of uncertainty, but certainly having a coordinated system would have helped everyone involved.
Now I want to go back, Jen, to the point that you made in terms of the model itself, whether this is the best model or whether another model such as universal childcare would be one that could be more advantageous. Based on what you've seen during this pandemic, um, fingers crossed, once we start getting out of this phase of the pandemic, where we can start to really look at the next steps. At the macro level, what policy discussions will you be looking for, and with regards to childcare in Saskatchewan and Canada at large?
I think that it has become really evident that childcare workers are not just essential workers during the pandemic, but have always been essential workers. And we can't actually have not just equality for women who tend to be the primary caregivers in families, even when there is a dad involved in the picture, but for children generally. So this is what we see serving the core communities, is that there are a number of children in each center. It's not overwhelming numbers, but there are a number of children in each center where the daycare is their safe place and their comfortable place where they get the good meals and they get the attention that they need, access to various speech therapists or different kinds of one-on-one attention. And I think one of the reasons that we see not a huge number of these children in the centers is because families who are exclusively receiving social assistance can't send their children. They're not eligible for subsidies to send their children to childcare. There are so many people who could benefit from having their children in childcare so that they could get a leg up. But the children could also get a leg up in terms of language development, nutrition, things like that. I think that our very poor childcare system in Saskatchewan perpetuates inequalities. It exacerbates them. It's doing nothing at this point in time to bring a greater degree of equality across our province. So we need something much better than this. And I see it as a door opening, the fact that early childhood educators were declared essential workers, that once we have come out of the worst of this pandemic, we can sit down with policymakers to say, okay, if they are essential, what does that mean? How can we treat them as essential?
Jen, this has been fantastic. I've learned a lot, and those are all the questions that I have today. Thank you so much for your time. Is there anything else that you'd like to add for that you think our viewers would like to know?
Well, so one thing that interests me, and as an avenue for research, is I would like to see how childcare centers across the province of Saskatchewan and elsewhere in Canada are responding to the Truth and Reconciliation Commission's call to the all levels of government to ensure that culturally appropriate early childhood education is available for Indigenous kids. And that is something that is not written into the curriculum here in Saskatchewan yet, although there are a few things that individual centers choose to do in terms of cultural programming. I think that there could be a very there's a lot of room for innovation in that front, and not only in childcare centers that are run by our First Nations and Métis governments, but ones that are there for the public as a whole, including our Indigenous publics. And I think that there's lots of room for growth there. So if anyone has any interest in this or knowledge in it, wants to collaborate on research, I'm at the Canadian Centre for the Study of Co-operatives, and that would be a great thing to explore.